Hello guys, Medicine Med Easy here, and we are here to talk about a topic today that is the blind loop syndrome, aka known as the small bowel bacterial overgrowth syndrome. Now, the thing about this disease is that we know that the small bowel or the small intestine is composed of a lot of colonic bacteria. Now, the colonic bacteria, the thing about this colonic bacteria is that these provide very much beneficial effect to our body, like they help in the various immunological processes. Then they also help us in different kinds of absorption, digestion, and also in various benefit. They have a lot of beneficial roles. They even also they also prevents the other bacteria which might be may cause harm to our body to not grow. And the amount of this colonic bacteria is actually not more than 10 to the power 4 per ml. So this is the actual total amount of the bacteria which might be present, and they usually come from the saliva. Now, in this disease, what happens is that there occurs the overgrowth of these bacteria, and this overgrowth of bacteria leads to the production of a large number of bacteria, that is up to about the amount of 10 to the power 8 to 10 to the power 10 per ml. So we can already see that these bacteria are already smiling, like they have a huge opportunity to do some damage to the body, and that is what they do. Now, what could be the causes behind this? Now, you should know that when this is a normal physiology, the presence of the colonic bacteria. Now, when this physiology is disturbed due to any cause, this will cause this blind loop syndrome, right? So let's take a look on the causes. Like, for example, here when we see, first of all comes here, there is the stomach, and there's a condition that is the hyperchlorhydria or achlorhydria, characterized by like the decreased or like the absent gastric HCl. So what could it cause? Like when the person has pernicious anemia, there occurs an autoimmune process leads to the destruction of the parietal cells, which doesn't produce the gastric HCl anymore, or there's no production of gastric HCl at all, which may lead to the increased amount of bacterial overgrowth. And the person might also go under partial gastrectomy, which may lead to this condition as well. The second cause which may arise is the impaired intestinal motility. Like when you have different kinds of diseases which might be associated, like the person he has like diabetes mellitus, or the person has systemic sclerosis, which is a rheumatological disease. So in these cases, there occurs the impaired intestinal motility, which ultimately reaches to the bacteria to overgrow. Now, there might be some structural abnormalities which may lead to this condition, like for example, the person undergoing a different kind of procedures like the gastric surgery. For example, the person has gastric surgery. Then what happens in the gastric surgery is that this may lead to a condition which may also cause hypo or achlorhydria, which may cause the blind loop syndrome or the overgrowth of bacteria. Now, there might be also the impaired immune function, which is usually idiopathic, leading to hypogammaglobulinemia. Hypogammaglobulinemia with reduced hemoglobin M and hemoglobin A levels. Now, what happens here is that due to these causes, like the amount of bacteria increases, and this bacteria, what they do is they usually produce symptoms in the body, like they produce chronic diarrhea, malabsorption, and like recurrent gastrointestinal infections. Like therefore we can already see that due to all of these causes, the person will get a lot of clinical features. Like for example, now if I write like 4 causes, first comes the diarrhea. The person will present with diarrhea because the bacteria is overgrowing, and they will cause recurrent infections leading to this diarrhea. Second comes steatorrhea. we know that what is steatorrhea is that like when the fat is not absorbed well, this increased amount of fat produces a characteristic stool that is a like sticky like stool, fatty stool, which is known as the steatorrhea. And why does it happen is that due to the malabsorption of fat. And besides, we know that these bacteria are responsible for the deconjugation of the bile acids and the bile salts, which leads to which doesn't lead to the formation of the micelles, which are needed for the fat digestion. Therefore it causes like the steatorrhea. Then what happens, the person presents with anemia due to the decreased amount of vitamin B12. Therefore the anemia will be mainly megaloblastic. Why does this happen? Like the bacteria, we know that the bacteria use up the vitamin B12. So when they use up the vitamin B12, there will be anemia. And the final clinical feature which will present is due to these associated conditions that I've already taken, that the associated intestinal comorbid symptoms. Now what could be the investigations we might do for in this cases? So first comes what I would do is the barium meal or the barium follow through. The next test that we might do is we can do a biopsy. Now the biopsy is not a definitive term in this case, because the person is mainly getting malabsorption, which might be also due to an idiopathic cause. But the problem is that with biopsy we can actually exclude celiac disease, which is one of the main differentials in the case of in this case. And then the person, what we can do is we can do other investigations. For example, we can order the vitamin B12 and folic acid amount into the body. And now already I've told that the bacteria will use up the vitamin B12, therefore the amount will be decreased in case of vitamin B12, but in case of folic acid it will increase because the bacteria will produce the folic acid. Therefore the amount of folic acid will increase, but the amount of vitamin B12 will decrease. Now the later part comes the breath test. There are different non-invasive breath tests. For example, the hydrogen breath test, in which usually the person is given a glucose or lactulose, which the colic bacteria usually metabolizes, and with the breath comes out the hydrogen. Now in case of this disease, that due to the bacterial overgrowth, there will be the metabolism will be a lot faster than the normal type, and will cause the blind loop and will give a definite diagnosis of the blind loop syndrome. And the last it comes the immunoglobulin levels. Since we have already discussed that due to the impaired immune function like hypogammaglobulinemia, there occurs the increased production of the bacteria. Therefore we have to take the immunoglobulin levels. Now what could be the possible management in this case? First of all comes the broad spectrum antibiotics that can be given. For example, it is usually given for 2 weeks. Now when we give the broad spectrum antibiotics, we have to be sure about what we are giving. For example, these antibiotics should cover both the aerobic and the anaerobic organisms, which might be important. For example, we can give tetracycline, metronidazole, ciprofloxacin, amoxicillin, which might be helpful and is given for 2 weeks. And when we do the breath test, if we get the increased amount of methane, then we can add the neomycin, which has been shown to benefit the patient's symptoms. We have to give intramuscular vitamin B12, as I've already told that vitamin B12 is used up by the bacteria. Therefore, there occurs like megaloblastic anemia. We have to, therefore, we can treat this by giving intramuscular vitamin B12 supplementation. Now, when there is diabetes and systemic sclerosis, what happens in case of diabetes is that it causes diabetic neuropathy, which is one kind of disorder which leads to impairment of the intestinal motion. And in case of systemic sclerosis, there is like chronic sclerosis or fibrosis of the circular and longitudinal muscles of the intestine, which impairs the motility and leads to overgrowth of the bacteria. Therefore, we can treat it by giving an anti-diarrheal drugs, which has been shown to help. Now, sometimes the most cases, in case of the person who are hypogammaglobulinemic, it has been characterized that the most of the bacterial overgrowth occurs, that is the giardia. Now, in case of giardiasis, what we give is the metronidazole and tinidazole. And if this fails, we usually try to give the immunoglobulin infusions, which has shown to give promising results in this case. So that's it, folks. If you like this video, don't forget to share the like button and subscribe and share to people and spread the love of knowledge. Thank you.